Is Riley Richards. This is my O4A1 assessment, both task 1 and 2, for my exercise technique and demonstration. So for both of my task 1 and 2 videos, I will be demonstrating both a lower body primal movement exercise, an upper body primal push exercise, an upper body pull primal exercise, and a rotational exercise. So for each I've chosen a row pull, a Russian twist, a shoulder press, and a squat. So the first exercise that I'll be doing is a pull exercise. So this is the shoulder press. It's a compound movement and concentric movement, because you are trying to work the muscles and pulling them to stretch them out, which kind of activates them and kind of gets them to move more, and you're really targeting the muscles. So the muscles that you'll be targeting, so agonist muscles, are your triceps and deltoids, just on your shoulders and under your arms, and the synergists are your biceps brachia and then your latissimus dorsi, and the joints that will be moving are your shoulders when you're extending, so shoulder extension and elbow extension, and then flexion as you bring them back down. So in this case, I will just be using a 3 kilo dumbbell just to show you, so it's a bit easier. So you just sit back straight on the bench and keep your shoulders at like a 90-degree angle with your arms, your kind of like forearm and your arms and your shoulders. So kind of push up so they may touch a bit to the top, and then bring them back down, controlling as you go down and up again and back down, keeping that 90-degree angle. Don't go down too far, and also don't kind of stop around here, keep it at that 90. So back up again just so they touch, and back down like so. So this is my client Satine. First of all, I just want to get to know how she knows how to do it. So first I'll just get her to do it. Right, so I'm going to stop you right there. First of all, bring your arms up at a 90-degree angle and try and keep them, so when you're stopping, try and stop them at that 90, and then kind of bring them up so that they touch just at the top there, and then back down, and really controlling it as they come down to stop at the 90. Stop right there, yeah, and go back up to the top, touch them at the top, and then back down and just stop there. Perfect. Back up one more time. Perfect. And making sure that your back is straight, just so that, especially if you're lifting heavier weights, you won't strain your back, because that can be an injury that can occur later on. So making sure you're keeping that really steady and controlling as you go up and down. So my next exercise is a row pull. So it's a compound movement as you're moving multiple muscles. So your agonist muscles that you'll be primarily moving are your latissimus dorsi and your biceps brachia. So your synergists are your deltoids and also your triceps. First of all, I'm just going to show you how to do it. So you kind of put your legs onto the foot plants and kind of gently pull. Don't kind of hunch your back. This is how you're going to strain it. Kind of keep your back nice and straight, and move back a bit so your knees have a slight bend, and you're going to pull towards like your chest. Squeeze your shoulders and your lats together for about 3 seconds, and slowly release back down and pull again. Really squeezing and control as you're coming back down. A few more times. The key thing is to be controlled, especially as you're releasing it back down and pulling it away from you and pulling it towards you. So I've got my client Satine here. So first of all, I'm just going to get her to do it, so I can just get a rough idea of how she knows how to do it, and then I can adjust her from there. I'm going to stop you right there. So first of all, she's leaning back way too far. She needs to keep her back nice and straight, posture nice. And then she's going to gently grab this again, and try that again, making sure that there is, if she shuffles her butt back a bit more, just so there's a slight bend in her knee, keeping that back nice and straight and really pulling that towards her, squeezing for about 3 or so seconds, and controlling as you come back down, making sure that your head is nice and straight as well, aligned with your spine. And up again, making sure you're really squeezing your lats, and back towards. So the joints that are moving here is your shoulder and elbow flexion when you're pulling towards you and then extending back out. So your flexion when you pull in and extending when you pull out. That's perfect. My next movement is a rotation movement. So this is a Russian twist. So this is a compound movement, and your muscles moving are your obliques on your sides and your rectus abdominals kind of in the middle, or your abs known as, and your synergists are your hamstrings, especially if you are lifting your legs. You're trying to control those muscles there, keep them up as well. So the joint movement is just your trunk rotation. Right, so I'll just show you how to do it. There's many ways to do it. You can do it with weights, you can lift your legs with weights, or do it just lift your legs. I'll just show you the easier way starting off with. So you're going to have your feet planted on the ground, or you can have them elevated a little bit. I'm just going to have them planted on the ground. Keep your back nice and straight, kind of at a 90-degree angle, I would say, and then turn to the right. Not too much, because that will strain, which can cause you injuries. So turn to the left a bit and the right until you can really feel that muscle. And you stop when you can feel it, and just keep doing that. So another way, and you can lift, so cross over and lift your legs a bit. So this can also work your synergists, your hamstrings a little bit. Turning, and this also targets your lower abdominals. Turning, and just trying to stay balanced as well. My client's setting to do it now, so first of all, we'll just see how she does it. So off the bat, she's turning way too far. She needs to turn to a little bit to the left and a little bit to the right, just so she can feel those muscles working, because otherwise you'll just strain fully. So that's the perfect example. So my next exercise is a lower body exercise. So this is squats and also weighted squats as you get a bit more, as you progress more in this exercise. This is a compound movement as you're moving multiple muscle groups. And your agonist muscles here are your quadriceps. So your quadriceps, your gluteus maximus and medius, and also your gastrocnemius on your calves. And then your synergist is your rectus abdominals, as you're which keeps you stable as you're going both up and down with your squats. So the joint movements here are both your knee and hip flexion, and then your ankle plantar flexion as you're pushing up and then extending back down. So first I will just show you before I do the weights, and then I'll get my client after, but first I'll just show you. So just kind of have your feet shoulder width apart, and try to balance yourself as well, and then kind of squat down like you're sitting on a chair. Don't lean forward too much and don't lean back too much. So you just want to go down, keep your head nice and center and your torso and your shoulders back like that, and as far down as you can. And from the side, it's like you're sitting on a chair like so. And try not to push your knees in, try to push them out as you come up, especially when you're doing weights. So now I'm going to show you with a weight bar. Just going down and up again, down and up, and from the side, down and up, and down and up. A safety thing for this is that if you're lifting heavier weights, especially with bars, it is really good, or you should have a person on each side of you and behind you, just because if you fail, you probably get hurt by the bar. So it's just a safety hazard. So making sure you're having your safety people with you that can help catch that weight if you do fail when you're lifting heavier as well. And also don't lean forward too much or back too much, because that can strain your back. So now I've got my client Satine. So first of all, I just want to see how she does a squat, and then I can adjust her from there. Okay, so I'm going to stop you right there, looking from the side and front, so lateral and anterior. I can see that she's going down way too far, good depth, but just a bit too much right there. She's still leaning forward quite a bit. So try to go down again, keep your shoulders back and your torso kind of straight as much as you can. Don't lean forward too much, and also don't go down too far. There we go. That is much better. And now from the side view, as you can see, she's not going down as far, and her back is nice and straight and centered with her spine as well. Straight in here, so her head is also centered with everything else. That's a perfect example.